Hi, everybody. I'm Jean Ketchum, Aging But Dangerous. And we have a really special guest with us today. And I'm very anxious to talk to her because she's going to have wonderful information for us. And her name is Sue Gehlsen, and she's the executive director of St. Mary's Health Clinics. And Sue, welcome to our show.
Thank you, Jean. I'm happy to be here.
Well, we're just excited to have you and talk to you.
Good.
So tell us about the St. Mary's Health Clinics, would you please?
I sure will. I'm happy to. St. Mary's Health Clinics is a ministry of the Sisters of St. Joseph of Carondelet here in St. Paul. And we serve the uninsured population. And we have 7 different clinic sites throughout the Twin Cities. And our administrative offices are located right next to the Sisters in St. Paul off of Randolph. And we have a very, very interesting setup, Jean. Our providers are physicians and nurse practitioners who donate their time, so they're all volunteers. And then we have a very strong base of nurses, interpreters, admitting people to help us out, again, all volunteers. We have a total of about 275 volunteers, put them together, who provide the direct care in the clinic sites. Ordinarily, during non-COVID time, we have 10 clinic sessions a week at various locations, as I said, and they are generally half-day sessions. And the population that we are seeing primarily right now is Latino, so we have a very high rate of Spanish-speaking families.
So how has this COVID-19 affected, your procedures and your patients and your staff? I mean, that's wonderful. You have that many volunteer staff. I mean, is this hitting you? How is this hitting you?
Well, we have a wonderful medical director who has guided us through a lot of this. So that's been very, very helpful. We talk on a very, very frequent basis and meet over Zoom. But much has changed for us. Ordinarily, as I said, we have 10 clinic sessions. During the COVID situation, we are actually consolidating our services and have only 3 sessions. And we focus primarily on medication distribution and medication pickup. And we have some virtual and phone visits with patients. And so it's kind of a priority basis, those people that need to be seen. So right now, any of our routine physicals, exams, annual visits are not happening. Those are all being postponed. And we've got a location in the West Metro area in Shakopee, one here in St. Paul, and then one here at the Carondelet Center right now.
Mm-hmm. So if somebody comes in and they think they might have the virus, do you test them and then?
No, we're not a testing site. And actually, we contact our patients before they come for their appointment and advise them if they have any respiratory symptoms at all, we refer them elsewhere.
Oh, okay.
So, right. Yeah, our staff is protected. They actually pick up their medications from a table, etc., that is labeled and has been all screened and prescribed by our physician.
Mm-hmm. Okay, good. Well, okay, Sue, what can our supporters, we have a big following, and what can they do to help, and what do you need? I mean, what's needed now?
I would say, Jean, probably our greatest need right now is we're having difficulty getting many of our medications.
Oh.
And so purchasing them and financial support is a huge need and quite immediate for us. And that's been kind of tricky. I've been spending a lot of time trying to look at different options. So that's huge.
So you're having trouble getting the medications because of the money?
The money, yes. Insulin is a huge, we have a large population of patients with diabetes.
Oh, okay.
And so that's been a challenge for us, as it is for everybody, actually, but greater than usual.
Yeah, so you need the finances. And how do they give you money? You tell people where to go that they can
Okay,
contribute money.
sure thing. They can work through our Ministries Foundation, the CSJ's Ministries Foundation. They are our partner, and they do a lot of fundraising and grant writing and support for us through their efforts. So that would be a wonderful way to contact them. That you can reach them online, CSJ Ministries Foundation. And then there's links to click that. And you probably know they're also having their online auction.
Yeah, well, let me finish. Let me finish what
Okay.
you were saying. Excuse me, but
Okay.
yeah, and they're one of our sponsors. Everybody, so they have been our sponsors for like ever since the beginning of Aging but Dangerous. So you could go on our website, click on their logo, and it takes you to their website. And it's so important because even if it's like if you give $20, $50 a month, and have it taken out of your bank account. I know that's what I do, and it really does help. So okay, before we get into your gala, because I can't wait to hear, or your auction, can't wait to hear about it, but tell us an uplifting story from the last few weeks, inspiring story, can you?
Oh my goodness, there are many. There are many. We have the best staff ever, one of the best groups I've ever worked with, Jean. And they come back every time they see people and tell us stories. Many of our families, because so many are in the service industry, restaurants, housekeeping, hotels, that type of thing, have lost positions. And we had one family in particular, and it's a family of 5, and there were 3 people in the family who were employed, all of whom have lost their jobs. And they called us for assistance, and we were able to provide some food assistance, their medications that were needed. They were able to actually have an appointment with our physician on a phone because this woman was not sleeping. She was so anxious, etc. We were able to refer them to some other community resources to help them out, and they couldn't have been more gracious and appreciative of our
Wow.
assistance.
Yeah, that is so great. I mean, you guys do such good work there. I mean, all the ministries do, but it just warms my heart to hear, what you all do. So I know you were going to have a gala, and we all were getting very excited about it. And it was going to be in May, and it's always you have it every year, and it's a good way to raise money. I know you raise a lot of money that way.
We do.
And it was going to be so wonderful. Who was the woman that was going to sing and be who was going to
Oh
be,
gosh,
I think, not Jacqueline Steele, was it? I don't know.
I think she was coming back this year.
Yeah, well, anyway, whatever. It was going to be wonderful. But now with the new, stay at home and all this stuff we're going through, tell everybody what you guys are going to do now, because it's pretty exciting.
I think it's a really fun plan. We are going to have an online auction that will last a week, starting May 1st, with some very wonderful prizes. And if people haven't done an online auction, they really are quite fun, I think.
Yeah.
And again, you can get lots of information through the online CSJ Ministries, but there's some great prizes, some gifts of a week on a lovely resort in Lake Superior. And then there's some weekends also at a lovely resort on Lake Superior. There's a winery tour. There's other outdoor type gifts, and I'm not going to go into a lot of them because you'll have to check it out, but
Right.
some very nice things to bid on.
And that is going to be from May 1st to May 8th.
Correct, May 1st.
And that will be, we will, Aging but Dangerous will send out notices on that and this next week, and we'll let everybody know what they can do and how they can get on and how they can bid. We'll make sure that that's, that that's out there. But I think that is just going to be a lot of fun.
I think it'll be great fun. And if people don't really want to participate in the auction, they can also just make a donation, and there's a quick and easy way to do that. Some people are a little skeptical of auctions, so this could be fun as well and very easy donations are appreciated.
So, Sue, if they buy something, how do they get it? Do they have to go pick it up? And
Well, that's a really good question. I don't have the details on that.
okay,
I
well,
have
we'll
to
find
check
out.
that
Yeah,
out. Yeah,
yeah. Because if they bought something big, I don't
right.
know. Well, we'll find out. We'll find out. But anyway, well, is there anything else you'd like to add?
Oh gosh, I'm always proud to talk about our clinics and the service they do. They've been around since 1992, Jean. And I
Wow.
think the clinics themselves speak so well to the mission of the sisters,
Yes.
because they started out helping people who had lost insurance between jobs, or had a waiting period, or were not able to afford insurance. And it's really evolved with the times. And as you
Hmm.
know, right now we have a very strong immigrant population.
Right.
And it's just the services have evolved, the population has evolved. They're very, very
Hmm.
committed to providing care for those that are less fortunate. All of our patients live within the federal poverty guidelines. So there's many, many challenges these families
Yeah.
face.
Sue, how long have you been with them?
I've been with them about a year and a half now.
Oh,
My
okay.
background is I'm a registered nurse, and I have been in various nursing positions throughout my career.
So
And
you can really sympathize with what's going on now, can't you?
oh, I can. Yes, I
Heartbreaking.
can.
Well, anyway, thank you so much. It's
Very
been
welcome.
great, and I've so enjoyed talking to you. And we will get the information out to everybody about your auction, and we'll stay in touch and do a follow up and let everybody know, how great it was.
Thank you, Jean. Thank you so
Okay.
much. I
All
appreciate
right.
it
Have a
very
great
much.
day.
Uh-huh.